The head of the state's contact tracing program has already made progress in overhauling the system. Today, Dr. Emily Roberson spoke for the first time with Always Investigating's Gina Mangieri.
For the first time, the health department is now collecting key data that shows what kind of settings and activities are spreading COVID and where and how it's being safely blocked. Roberson tells me decision makers can now know more about where the risks really are. Roberson joined the health department this summer just as leadership was coming under fire for a shortage of and lack of transparency about the number of contact tracers and a void in data about the mounting cases. As Roberson launched into an overhaul plan, she ran into pushback that prompted her to take a stand and a brief leave until chain of command could be sorted out. Dr. Bruce Anderson announced retirement. Dr. Libby Char was named his successor, and Dr. Sarah Park took leave. Talking to me today, Roberson didn't want to dwell on that and instead focuses on what is getting done by her contact tracing teams that now number 256 and growing.
They're reaching out as soon as people test positive in order to make sure that they have the information that they need in terms of brief education and to make sure that we're able to screen for any specialized follow-ups that might be needed.
First contact callers are dialing up every positive person within 24 hours and screening for specialized follow-ups.
We have about 50% of the people that we attempt to reach within 24 hours. We're either they have a bad number, they have no number, or we are just not able to get them on the phone.
Of those they can reach, they sort among 8 specialized investigation teams. Additional targeted support such as nurses, community workers, monitors, and even translators can jump in when needed. On top of that, the city is soon to add 80 tracers and build up to 250 more. Roberson changed the forms and the procedures to collect more detailed data.
In the past, instead of having these open-ended questions where people could just kind of say, oh, well, I went here and I went there.
That was a problem first exposed in an earlier Always Investigating report that showed the intake forms did not align with the categories that state and county policymakers said they were monitoring for what to shut down or keep open. It was a hot topic again today at the House Economic Impact hearing.
It would be a monumental failure on our part as a community if when we see that next surge, if we're not poised to make decisions in a more deliberate fashion.
Now, Roberson tells me her team has collected weeks of data that gets down to business.
It does include questions about gyms, personal care services, congregate settings, schools, correctional facilities, and a whole bunch of information about that. Restaurants, for example, bars. We can be able to advise the politicians and the decision makers a little bit more about what the risks are and what the risks are not.
I asked what the new data is revealing so far.
There's a lot of times where we might have clusters that involve a specific type of employee or a specific workplace, but when we really investigate further, then we find out that the transmission is taking place outside of that location.
That's consistent with what small businesses and organizations have been saying about their own contact tracing, finding off-work social spread, not on the job or in-store, where masks, distancing, and sanitation regimes are followed.
As a business, we're already doing that. So we know it's not coming from us. If the majority of the numbers are coming from funeral homes or private parties or care homes, I mean, we need to take that into consideration, too, instead of a full shutdown.
Roberson says cloth masks appear to be working better than she ever expected, and they're looking at reporting whether masks were used in case data.
Masks really do seem to be working.
Gina Mangieri, KHON2 News, Always Investigating.